Hi, welcome back. This is Benjamin Turner, your behavioral health advocate, hanging out here on the Lightning Step couch at Global Exchange 2023. Sitting with me today is Josh Thelen. He is an intensive case manager at the Right Door for Hope, Recovery, and Wellness in Ionia, Michigan. Am I saying that right?
That is correct, Ben.
Awesome, Josh. Tell me a little bit about yourself and what you are here to do.
I came to the conference to kind of explore, learn a little bit more about what was out there, really focus on some of the extra modalities, the self-care aspect. And during that, I have really picked up on a lot of AI technology
Okay.
that's been out there to decrease burnout,
Okay.
take the load off the clinicians. And somewhere I was really feeling why this conference really stuck out to me is with Dr. Vanderkolk speaking.
Okay.
Um, with Leisha Sky and just a lot of that interpersonal looking inwards that the conference focused
Awesome.
on mental health, that the burnout piece is something I felt a lot of.
Okay.
And the
What
AI,
did you learn? What did you learn that you didn't know?
um, the switching the compassion fatigue, more of
Hmm.
focusing, calling it empathy fatigue, as far as
Okay.
what we were taking in and where that secondary trauma and stuff can affect us, and how to mitigate those risks and that burnout on ourselves.
Hmm.
So I've really taken some of that away from it, and I think it's going to be beneficial in my work.
Okay.
The intensive case management, obviously, it's intense. See clients a little more regularly, a little um, larger issues going on with this, um, dual diagnosis, some
Hmm.
triple diagnosis clients. And so I really get pretty deep with them, with sometimes 4 or 5 visits a week if somebody's in a bad place. And the piece of being with the clients and taking care of myself has always been a hard line. Um, but along that line, the takeaway of paperwork
Hmm.
really being a burden to clinicians like myself, and seeing that as a large burnout piece,
Okay.
and hearing that amongst my agency. So this conference has brought up some interesting AI that has
Yeah.
kind of really jumped out that I feel could take away that load off myself and others in
Yeah.
the same
Can you
position.
go into that a little bit more? How is AI going to benefit us?
Well, I ran across a company, Commonly Well, here. They have a platform that they've developed now that's going to use AI to develop a person-centered plan. So
Okay.
the PCPs, that when we get somebody into treatment, after we have an assessment and stuff done, the clinicians sit down with them and get those goals and everything going. And if AI can sit down and virtually write that plan for me, where I can go back in and edit it with the
Hmm.
individual, it's potentially an hour per person that comes off of
Yeah.
my load.
Yeah.
And if I'm doing that multiple times a week, or even further, initially we worked on a 12-month person-centered plan. And since we became a community-based health clinic, we're now at a 6 month. So
Okay.
I couldn't reach goals oftentimes working alongside somebody in 12 months. The thought of how am I going to do that in 6 months puts even more
Yes.
stress on that
Yeah.
load.
Absolutely.
And if I can take that away, I mean, to
Yeah.
me, it's like, why is that technology? Put it in
Not
everybody's
already
hands.
in there. Yeah.
Yeah. And
Yeah.
another one was Dr. Talbot is here, and his
Okay.
company has brought up a platform for assessments, that large area for intakes.
Hmm.
So we have a full assessment on intake, but now we also have assessments get done on a annual, and also you have an assessment update if there are any large changes in someone's life. And to use AI to take those hours off of
Yeah.
the schedule, to me, it was just
Yeah.
astounding. I'm really
Absolutely.
excited to see
Good.
what the future holds in those arenas.
Yeah, absolutely. I think AI is going to be a major player in the future of how we operate and how clinicians can add more time to their patient care. So aside from AI, and we were talking about staff burnout. How can technology better or decrease the burnout, and maybe how is it increasing the burnout currently with our current technology that we have? What does that play with staff burnout?
I think just the overloaded paperwork.
Hmm.
As a clinician, you go into a helping field in those hopes that we want to facilitate change. We want
Hmm.
to help.
Yeah.
And when we're bogged down with paperwork, there's just no time for that.
Yeah.
I feel often as a paperwork shuffler, and I'm not advancing patient care, and that facilitates to burnout, is that you're not able to help that person, and to go home every day and say, what difference did I make?
Yeah.
That's hard.
Absolutely. Um, Again, AI, we see the steps that AI is taking to make it easier. Um, Sorry, we'll cut there for a second. We'll get back into it. What is there? Tell me a little bit about what I'm missing. Is there anything else that you want to get across to our guests here at GXC that we haven't brought up?
I think we just need to be more open
Hmm.
to the technology and the things. The COVID pandemic, I guess, as we view it, brought a lot of Zoom and pieces, and we've seen great change in technology advance over the last 4 years, and it's really not hitting. Um, I think the clinicians' pocket
Yeah.
yet. I mean, I hear a few. Clinicians getting use of this in Michigan, so where I'm located, and they said they CCBHCs have put this into play, and they're seeing the RCI, so it's able to track outcomes, which obviously everybody's
Hmm.
the bottom line is everybody's looking at outcomes, and if they can see positive outcomes, how are we not rolling that out?
Yeah.
And I think that's the biggest piece that if the technology is there, how are we not advancing it faster
Absolutely.
to effectively
Yeah.
make change?
Uh, do you feel that behavioral health centers and addiction treatment centers are utilizing technology to their fullest?
Absolutely not.
Okay.
It's out there. I'm seeing so much here. Um, Remote stuff, remote monitoring, check-in pieces for even recovery centers'
Hmm.
abilities to do things. That it'll be amazing. I
Yeah.
think the next couple of years, if this gets out there to really
Absolutely.
advance this, and I think the turnover that we see at community mental health and other agencies is if we can reduce that empathy fatigue and bring the wellness back to the clinicians, is people are going to have longer time in this field. They're going to have a better time feeling that they're making some effective change and helping
Absolutely.
clients work through
Yeah.
their goals.
Why do you think centers aren't utilizing technology to their fullest?
I'm really hoping we don't know
Okay.
that we just, I'm really
Yeah.
hoping that's what it is, that we just don't know it's there. So
Yeah.
my goal is some of the stuff I've gathered here is to take it back and be able to sit down with our CFO and kind of put it on the table. Like this, is this possible? Can we look at this? Can we get grants for this
Yeah.
kind of technology? Can we build this into our platforms and utilize this information?
Do you think technology leaders are listening enough to the people that they serve?
I'm not sure about
Okay.
that one.
Yeah.
I
Yeah.
don't know. I feel we have an ear
Hmm.
at our organization. State dollars, for a CMH is a lot of the control, so that may be a hurdle, and red tape
Yeah.
oftentimes.
Yeah.
Um, but it would be, I would hope that places with the ability to it are taking advantage of it and
Absolutely.
hearing what the boots on the ground say. But I think ultimately know that it's it's harder to push a snowball uphill.
Yeah. Yeah. Staff burnout is definitely affecting the vast majority of behavioral health centers across the country. There's no doubt about that. So I hope that we can do a lot more to ease that burden, listen more, and just serve those folks that are serving others as much as we can.
Be nice to see.
Absolutely. Josh, it's been a pleasure to have you on the
Thank you so much,
couch. I
Ben.
really appreciate it. Again, this is Josh Thalen. He's an intensive case management worker at the Right Door for Hope, Recovery, and Wellness in Ionia, Michigan. Josh, it is such a pleasure to have you on the couch.
Thanks, Ben. It's been a pleasure.
Thank you so much.